Hi, I'm Ana Cahulogan, 27 years of age, a resident from Camanaga, San Miguel, Bohol, and applicant of San Miguel Technical Vocational School in the 2nd District of San Miguel. So here is my semi-detailed lesson plan that I will be discussing today. Okay, settle down class and let's begin the opening prayer. Okay class, good morning. How are you today? So, settle down and pick up some pieces of paper under your chairs and settle down for the checking of attendance. Okay, so as far as I can see, no vacancies, so meaning there is no absent for today, and let's clap our hands for you. For you are doing a good job. So today, before we start our topic, we should always understand or what are we going to know in this topic. So we need to know about what is the importance of personal health care and what are the services that they will give and who are the qualified health care providers. So those are the things that we need to understand or to be learned today. So in this situation, this current situation of the world today, I know some of you don't know what's happening or like that, or what's going on in today's situation. So are you familiar with the word frontliners? Yes, very good. So frontliners are named as the new heroes of today. So they are not just medical practitioners or medical professionals, but they are also the individuals like the Philippine National Police, the Philippine Army, the Philippine Navy, and even barangay tanods are called as frontliners. So these people are fighting and risking their own lives just to fight against this COVID-19 pandemic. So they are the ones who are giving us safety. They are curing the infected persons of COVID-19. So let's be thankful for them for their presence in curing and for giving their own lives just to save the other people. Okay, before we start, I have here an activity. So the group or the class will be divided into 4 groups. So each group will be given a question for them to brainstorm and discuss for 2 minutes. And after that, the representative of the group will present their answers in front of the class. Okay, so group 1, your question is, what are the healthcare services that we can get from this personal health care? Group 2, how important does personal health care to our lives? Group 3, what does this personal health care provides? And lastly, group 4, who are the qualified personal health care providers? So, your 2 minutes starts now. Okay, time's up. So, let's hear the answers of group 1. Okay, clap your hands for group 1. Group 2. Okay, very good. Clap your hands for group 2. Now, group 3. Okay, tatlong palakpak sa group 3. Okay, how about group 4? Okay, very good. 5 claps for group 4. 1, 2, 3, 4, 5. Very good. So, before we start, what do you mean or what did you understand about personal health care? So, personal health care is also part of it is also a kind of health services. It is also a kind of health service. So this personal health care gives a person protection and advantage beneficial to him or her. So this personal health care can be availed in hospitals and any other agencies also. It is now on application online, or you will go exactly or directly to agencies related to health services. Now, what are the advantages and the convenient uh, thing about this personal healthcare? So this personal healthcare gives you a 24-hour appointment and access to inquire about health inquiries. And the one that will answer you is all a certified doctors, a registered nurses, a certified physicians on internal medicine and family medicine. So they are the one who will answer your calls and queries. Many of you or some of you may experience on-call doctors. So these on-call doctors, anytime you can contact them for emergency checkups, visit, appointments, and or family emergency if someone of the family or your loved one has or gets sick and need to visit the hospital. One thing that is convenient with this personal healthcare is when you got a online or on-call doctor, you can easily get appointments. No longer, when you go to the hospital, you will no longer fall in line to wait for a doctor, but you can easily go to the doctor to get the checkup. So, not just that kind of services, but this personal healthcare also provides and support and care you need and aims to ease burden of caring yourselves or your loved ones. So, they give also support and care that you need. So, for example, this COVID pandemic, the patients are being taken care of 24 hours. For the doctors will monitor the status of their health. So that is one of the examples. So what are the services that are given by this personal healthcare? So there are seven of personal healthcare services that is given. And first is ongoing supervision by a registered nurse. Just like what I give an example about the patients of COVID-19. So next, second is continuous care coordination. Next, ongoing health and safety assessments, assistance and bathing and dressing. For example, is that your loved one cannot go to the CR with alone, so someone will take care of him or her and will be the one to take her a bath. Now, medication management, meal planning, and preparation. Medication, if it is 3 times a day that she or he should take medicine, and the proper meal and preparation. So, light housekeeping and laundry services, assistance in getting to appointments and events. So, these services are being provided in hospitals or in your own homes if you have someone or if you have a caregiver in your homes for your elderly or your babies or for your children. Now, who are the qualified caregivers that will provide the services? They should be qualified and they should be what? They should be practiced and have already experience about providing these services. So these are the qualified caregivers. So there are 3 qualified caregivers. These are the home health aides, certified nursing assistants, sisters or companions. So these are the people who are qualified to give this kind of services. Okay, so are we clear? Do you understand about the qualified caregivers and the services? So these qualified caregivers, not just they work because they are paid for. No, they also give exceptional support, care, and expertise to those and a compassionate caring with genuine desire to help to improve one's quality of life. So they just not work to be paid for, to receive money, but they also love their work because they are passionate and they love to help someone to make her life again a beautiful life to look forward to. Now, are we clear? Okay, so the next activity that we will do is more exciting than the other activity. So the class will be divided into 3 groups. 3 groups. So each group will be given a specific task that will be based on a specific situation or a topic. Now, this topic will be discussed by the group for 4 minutes, and 4 minutes, and then after that, they will present it in class. So, speaking of tasks, the group 1 will do the task of dancing, group 2 will do the singing, and the group 3 will do the dancing. So, the situation that I will give will be expressed through dancing, singing, and drawing. Now, what will we do in grading? So, I have here a criteria in grading your performances. So, first criteria is choreography, creativity, and voice quality for 10 points. Second is the content and the composition of your task. It is also 10 points, so a total of 20 points. Okay, so your 4 minutes, the situation is based on an individual that shows support, care to their clients and loved ones. That is the topic. So your 4 minutes starts now. Okay, time is over, and now let's, by the way, in your performance, I will just randomly pick who among the 3 groups will perform first. Okay, so the first to perform is group 3. The next to perform is group 1. And the last to perform is group 2. Okay, so clap your hands. And now let's start with group 3. Okay, very good, group 3. Now, how about group 1? Okay. Okay, very good, group 1. Then the last group is group 2. Okay, very good. So, clap your hands. You did a good job, guys. Thank you for these wonderful performances. Now, the grade for group 3 is 18 points. How about the group 1? 19 points. And the group 2 is for, yes, very good, 20 points, group 2. You did a good job. Now, and I hope that each of you understand what is the meaning of personal health care and what on how, in a way, that it is very important to us to stay healthy and to have someone that will take care of us, that gives also exceptional and genuine desire to help us and every one of us. So don't forget, your assignment for next meeting is for you to research the skills in playing softball. Okay? So, again, remember your assignment that next meeting, you need to research the skills in playing softball. So, that's all for today, and take care everyone, and God bless.